Joan Lunden. Welcome to the Small Steps to Help You Manage Your Diabetes series. This is episode 2, Partnering with Your Healthcare Professional. One of the most important aspects of diabetes management is the interaction between the patient and their diabetes healthcare team. Your healthcare team starts with your primary care physician or endocrinologist, but can include other healthcare professionals like a diabetes educator, dietitian, nurse practitioner, a foot doctor, an eye doctor, or any other specialist. Diabetes is a disease that can be managed, but it requires more of a partnership. You have the most important role to play, since you are responsible for your day-to-day care. But part of that role is sharing with your healthcare team what you're doing to manage your diabetes. You're the one who lives with it every day. And in order to get the most out of your team's expertise, you need to share with them what you know. That gives them a more complete picture of your condition. It's important to remember that your healthcare team is your most important resource for diabetes care and advice. And this episode will help you take small steps to foster more productive office visits, be prepared to talk about your diabetes, and gain a better understanding of self-management of diabetes care. I hope you enjoy it.
So you can see how small steps can go a long way. See you next time.
And cut. That's a wrap. Great show, everybody. Save the lights. Great show, Dr. Reichman.
Thanks. I enjoyed it.
Good job.
See you next time.
Judith.
Hi,
How you doing?
I'm good.
I just caught the end of the show.
Yes, well, this one was about patient relationships with their healthcare provider.
That happens to be perfect for the series that I'm working on right now.
Oh, great.
Well, you know, we were contacted by a couple, Sandra and Cedric has type 2 diabetes, and he doesn't feel that he is getting out of his doctor's appointments what he'd really like to. And they're so thrilled that you're willing to come and talk to them about this.
Well, I'm delighted to come and talk to them. A lot of people don't understand how really important, especially with diabetes, it is to be a partner in what's going on. People with diabetes need to realize that they have a really important role in managing their condition between appointments.
I think Cedric is just kind of confused by the whole thing. Part of what he doesn't understand is why it seems like sometimes everything goes great and then other times it just all falls apart. And not only is he confused, but Sandra's feeling it as well.
Well, that's very, very common, and I hear it all the time. You know, it's very difficult for the doctor to spend as much time as she or he would like with the patient because we're all sort of inundated with huge numbers of patients and we have to do so much. But we all want to establish a relationship.
But sometimes I guess the patient has to work on this too, so that's where you come in. You ready to go?
Absolutely. Let me just change. Okay.
My name is Sandra, I'm 52 years old, and my husband Cedric is 55, and he has type 2 diabetes. He does pretty good though. We try to exercise together every morning. We walk around the neighborhood, nice brisk walk. He's actually quite good about what he eats. He's taken a lot of what he's learned from his dietitian, and he does a lot of the cooking himself, so that's really nice. However, sometimes he treats a little bump in the road as a personal failure. Sometimes he thinks he can control things, and I said, well, that's unfortunately not the way life works. You don't always have control, so I'm just trying to get him to talk to his doctor more, to be honest. You know, communication is everything. It's key.
Sandra.
It's such a pleasure to meet you, Joan.
Well, it's nice to finally meet you, and I want to introduce to you Dr. Judith Reichman.
Hello, Dr. Reichman. Thanks so much for coming over.
Oh, well, please call me Judith, and it's my pleasure.
Oh, well, thank you. I will. Please come in. Have a seat.
So, where's Cedric?
He'll be back shortly. Actually, he's at an appointment now.
Yeah, I was diagnosed with type 2 diabetes about 5 years ago. It came as a really big shock. I've been seeing the same doctor ever since then. My doctor is a great guy, but it seems like we go over the same stuff at every appointment. And to tell you the truth, I don't always understand a lot of the things that he's trying to say to me. Like anyone, I'd like to feel like I have some control, like I'm making some progress. And that's why I'm really looking forward to meeting with Dr. Reichman and hearing what she has to say.
Hey, baby, I'm home.
We're upstairs.
Okay.
This is Joan.
Hey,
So nice to finally meet you.
how you doing?
And this is...
Dr. Judith Reichman.
Hi
I've seen
there.
you on TV.
It's Judith.
Well. I've never come home to a house full of celebrities before.
Right.
Thanks for stopping by and talking with us, Dr. Reichman.
Our pleasure.
So, how was your appointment?
It was okay, but I still don't understand why we go over the same stuff every time. He checked my blood sugar and my logbook. Sometimes he says my numbers are good, sometimes they're not so good.
Well, honey, don't forget to write down your next appointment.
I will. It's in 4 months.
Okay.
Cedric, Sandra was telling me a little bit about how you feel about your doctor's visit.
He gives me a lot of information, but I don't understand sometimes what I'm supposed to do with it.
Well, it sounds like you have a lot of questions. What do you do to prepare for the visits?
I bring my logbook.
Well, that's great, but you might actually write down your questions before you go so you know what to ask him as far as things you don't understand.
Wait, I'm going to forget this. I got to write this down, okay?
I'll give you a piece of paper.
Okay.
Well, better yet, you can use a notebook to supplement your logbook.
I think there's one in the kitchen. Let me go get it.
Okay.
For a lot of people, a notebook is a great way to supplement their logbook. It's for anything you would like to discuss with your doctor. Remember, your logbook is for all of your blood sugar numbers. This helps contribute to a greater understanding of what's going on with your diabetes. Take the A1C, for example. That number gives an average view of your blood sugar levels over the previous 2 to 3 months. But your daily blood sugars, those ups and downs you record, can answer a lot of the whys that go with it. It's real-time information that helps you understand how your blood sugar is doing from day to day. Now, in your notebook, you can also write down a list of all the medicines you are currently taking, including the doses, and don't forget those over-the-counter drugs like aspirin and supplements. You should also include changes that may have occurred since your last visit, like changes in eating habits or activity, or any new aches and pains, for example. And since we all know the doctor may have a full schedule when you see her or him, try to prioritize any questions you may have.
This is really good stuff.
You know, it's small steps like that which can lead to more fulfilling appointments. And it never hurts to be prepared. It's also a good idea to bring someone with you just to make sure nothing is forgotten.
Oh, I can do that. Look, I hate to interrupt this, but would anyone like some iced tea?
I'd love
Yeah.
Unsweetened for me.
Okay, darling.
You know what? Why don't we all move to the kitchen, okay?
Sure.
Cedric, does your doctor know all you do to manage your diabetes?
You know what? I'm not sure.
Well, no one knows your health history better than you do. If you don't tell him, he can't know how you're feeling or what you're doing at home.
I think often the patients are, I don't know, intimidated by their doctors, so they don't have that dialogue. I mean, even Sandra could help you.
Oh, absolutely.
Yeah.
How long have you been seeing him?
Ever since I was first diagnosed about 5 years ago.
You know, it's up to people with diabetes to make sure their doctor has a complete picture of everything they do. That includes monitoring their blood sugars, watching what they eat, staying active, stuff like that. And of course, taking their medicines as prescribed. These things all make a difference in your health. And they can indeed impact what you and your healthcare professional decide to do in terms of treatment. I feel the relationship between a person who has diabetes and their healthcare professional should be more like a partnership, with each person having a role.
So what can Cedric do now to be more proactive?
Cedric, it's your health, so educate yourself as best you can. Your doctor is your partner to help you manage it.
I wish I didn't feel that my doctor didn't have enough time for me, like I was bothering him. You know what I mean?
Well, Cedric, there's no problem in asking questions.
Believe me, an informed patient is not a bother. You know, many medical offices are seeing a growing number of patients. And as a result, healthcare professionals use a kind of set framework to make sure they don't miss anything important when they're talking to or getting information about a patient. Has your doctor talked to you about the ABCs of diabetes care?
I don't think so. It doesn't sound familiar.
He checks your A1C levels, right?
Every time, yes.
And your blood pressure?
Yep.
And if he's checking your A1C, I bet he's checking your cholesterol.
Yes, he's always talking about good cholesterol and bad cholesterol, and he just started talking about triglycerides.
Well, those are the ABCs.
So A is for A1C levels, B is for blood pressure, and C is for cholesterol.
Yes, my doctor always talks about those three things first.
That's because checking these things and managing them well can help lower your chances of having a heart attack, stroke, or other diabetic problems.
That's really interesting. I didn't know that.
See, asking questions helps you understand how all of this stuff relates to your overall management of diabetes.
And that's what your notebook's for. In fact, write down any questions or concerns that come up between appointments, and write down the doctor's answers to your questions.
Great idea. Thanks.
Let's have our iced tea outside. What do you think?
That sounds great.
Okay. Honey, can you help me with a couple of things?
Yes.
Okay.
And you might also include what you eat and what you do to stay active, because that can really help your healthcare professional decide how to treat you.
Those are all the small steps that are going to make those appointments better.
What else did your doctor check?
Lots of things, actually. I never understand why they have to check my feet. When I have diabetes, what do my feet have to do with anything?
You know, people with diabetes are more susceptible to develop problems with their feet due to poor circulation or damaged blood vessels. Your doctor's checking your feet to make sure there are no developing problems. It's usually a good idea to bring shoes you can easily slip out of, just to make sure the appointment goes faster. He or she will also probably check your eyes and listen to your heart. Also be sure to mention any new symptoms since your last appointment, so these areas can be checked as well. It's nice to have a checklist of items to discuss to ensure that your next appointment is as helpful as possible. If you're doing that, you're already well on your way to forming a great partnership with your healthcare professional. So keep that logbook and bring it to every appointment. That's key. It helps your doctor know everything that's been going on since the previous appointment with regards to your blood sugar.
Now, Sandra tells me that you're exercising more, that you're just, I guess, generally more active, but what about what you're eating?
I'm pretty careful about what I eat, but I'm still having some trouble maintaining a healthy blood sugar level.
Cedric's become quite the gourmet chef. Don't forget to
Well, gourmet is pushing it a little, but I do know my way around the kitchen.
No. Ever since we saw that registered dietitian, he's been making all these delicious meals for the two of us.
See, that's awesome. So you're cooking and you're enjoying it, and you're aware of what you're eating. Now, have you told this to your doctor?
It's never come up.
Well, you should tell him. He'd be thrilled to know you're taking such good care of yourself.
That's true.
I will.
Okay. It's so important to be aware of, and yes, careful about what you eat. Your healthcare professional may ask you very specific questions about that. Food can have such a dramatic impact on your blood sugar levels. This is the sort of information that can help pinpoint problems and ways to make beneficial changes. Together, you and your doctor can figure out why you're having trouble maintaining your blood sugar levels and figure out the best way to address that.
But this has been so great for us to all get together. I
Thank
really
you.
thank you for contacting us.
Thank you for coming.
Absolutely. I
pleasure.
can't tell you how much I appreciate it.
All
This is like unreal, actually. But
Well, I hope
great.
it helps.
oh, I think it'll help.
I think it'll help
tremendously.
tremendously, yes.
The most important thing is to be proactive. This is your diabetes management, so be prepared to bring up any questions or concerns that arise between appointments. Also be sure to get an answer that you understand. If you're still having trouble, try asking the same question in a different way. Ask for some additional reading materials or even websites where you can get more information. There's nothing wrong with telling your doctor you don't understand.
You know what?
Yeah.
This has been so helpful. I'm actually looking forward to my next appointment so I can get this partnership going.
You know, this is not a passive condition, and you have the most important role in your diabetes treatment. As long as you can communicate with your doctor, he will find the right treatment options for you.
I'm just glad we could all get together.
You know what? Why don't we get together after your next appointment?
Oh, that sounds great.
Good idea.
You know what? How about lunch?
You're on.
You're on.
All right.
Take care, you guys.
Thank you.
We'll see you in
All
a
right.
couple of months.
No
Great
problem.
to finally meet
I
you.
know.
All right.
After
Good
all
luck.
this
Thanks a
time.
lot. Bye-bye.
All right, thanks for coming.
That was
Really good.
It's been about 4 months, and we're here to give Joan and Dr. Reitman an update and to have a little lunch. I'm doing much better, making progress, and so this should be fun.
Hey, good to see you.
Joan, how are you, Dr. Reitman?
You look great.
See, I told you.
We're all dying to know. What was the last appointment like?
It was great. I felt so good going in. I had a list of questions ready for him, and I had my logbook already for him.
I told you, small steps.
My doctor was very impressed with my progress. My numbers are good. I told him I was exercising more, and he actually thanked me for being so proactive.
That is so great.
I feel great. So great, I'm buying everyone here lunch.
Hey, that's great. Thank you.
That works for me.
In that case, let's look at this menu. I guess we should be looking at the lighter side.